You're watching CTOM TV. Knowledge is power.
In order for a gene to become oncogenic or cancerous, it has to either be turned on when it's not supposed to be or turned off when it's not supposed to be. So there are two types of genes in cancer that we look at. They're what we call tumor suppressor genes, and these are genes that prevent cancers from growing and prevent cancerous processes. And then there's also what we call oncogenes, and these are genes that are only supposed to be turned on briefly to fix a certain tissue or have some other function, and then they get turned off. Or they're only active in your embryonic state, and then they're never turned on when you're an adult. So what happens with these genes, with oncogenes, and fusion genes are usually oncogene based. They're genes that are not supposed to be turned on. And what happens is there's an accident or a mistake during the cell growth period when the cell is reproducing itself. And what happens is two portions of the genome get stuck together. And what happens is you will have a oncogene, the coding region of the oncogene that creates the protein that is normally supposed to be turned off, accidentally gets attached to the control region. So every gene has a control region. It's like a light switch, and that control region is either turned off or on based on whether that control region has what we call methyl tags. If it has methyl tags, it's turned off in most cases. And if it doesn't have methyl tags and it's turned on. There's a bunch of other things, but that's just sort of a generalized basic overview. So think of it as a light switch. So the light switch that is turned on from a housekeeping gene or a tumor suppressor gene that's supposed to be on all the time gets attached to a gene that's only supposed to be turned on briefly, a oncogene. So now you have this oncogene turned on, and that's what a fusion gene is.
Okay. And so you want to make sure that if you're using advanced diagnostics beyond the CT, MRI, biopsy concept, or you're going ahead with some sort of genetic or molecular testing, that it looks at fusion genes.
Yeah, it's a good general theme to have.
Okay.
And we'll be seeing a lot more data on fusion genes over the next few years.
Thank you for watching CTOM TV. Subscribe below and stay informed.